Within 1 year, I've done 15 to 17 this leg surgery due to vitamin D or calcium deficiency. Definitely, I will suggest to give direct sunlight because they need direct sunlight for the production of vitamin D. There should be circulation in the area where the bird is kept because it can cause sometimes this respiratory distress, irritations, and all. Only the owner should give some priority time for the birds also, a minimum of half an hour to 1 hour daily. If it changes that, it may start to show symptoms like feather plucking and all. Usually, I've seen in intelligent birds like gray parrots, macaws, cockatoos and all, they start to pluck it. Even smaller birds, which are very attached to the owners, will start to pluck to get the attention.
Welcome back to the Paws Effect Podcast. I'm your host, Dr. Kara, and I'm delighted that you've joined me again today. If you are new, please remember to subscribe, rate, or review us. It helps more pet owners and animal lovers find these conversations and the expert guidance we share each week. A quick thank you to Stitch for the scrubs that I'm wearing today. They look great, they feel amazing, and all of us at Hillcrest Veterinary Hospital wear them proudly. Today's guest is Dr. Tittu Abraham, Director of BirdX Avian and Exotic Pet Specialty Hospital in India. He's a leading voice in the care of birds, reptiles, amphibians, and other exotic species. In this episode, we're diving into what makes avian and exotic medicine so unique, how husbandry directly impacts animal health, and what pet owners often get wrong, especially when it comes to birds. Whether you're a bird lover, an exotic pet owner, or just curious about this fascinating field, there is lots to learn from this one. So you are a specialist and you deal with avian and exotic pets. You have opened BirdX in India. And how long has it been established?
Actually, it started 1 year back. To be specific, it was June 16 we started this journey. Now it's more than 1 year.
Wow. And this is a specialist referral center, or is this a first opinion practice?
Actually, it's a referral practice usually. So because very few do exotic animals here and birds here, so they do refer to this hospital. But I've got a good relation with the breeders here. So there are so many of the breeders. They supply to different parts of India. So I do consult many breeding setups and all. So that's like direct contact. They don't refer. Breeders do refer these pet parents.
And do you support pet parents directly, or do you require them to be referred through a general practice?
No. They can come directly. There is nothing.
Explain to my listeners, what does a normal day look like for you? Because obviously with the work you're doing, you are dealing with avians, you're dealing with exotic pets. Tell us some of the cases, for example. What does your day look like, on a Monday to Friday? What was today like?
Well, I will start with my basic practice because I'm a surgeon, basically, a small animal surgeon. So sometimes it comes with a mixed practice. I do consult in other hospitals as a consultant surgeon, like if there is fracture cases, if there is some emergency surgeries, I do attend that. So it's definitely a busy day. So we had a eventuation in the morning. So after that, I came here. So it will start with yesterday. So yesterday we had two surgeries. One is a ball python jowl abscess, and another was a motor vehicle accident that got a tibial fracture. So after completing the tibial fracture, I went to a farm that I consult, an exotic farm. So the time that I reached the farm is midnight, 1 o'clock. So I don't have time to schedule everything. So on a call, we'll have to go there. That is the thing. So it had an emergency with an anaconda, green anacondas. So those are rare now in India. We have got yellow anacondas. So the owner wants me to be there on a call. So it's 2 hours drive from here. I went there after consulting the anacondas and other animals that were hospitalized in the ICU section. After that, I reached here by 8 o'clock. So by 11, I got a call for this eventuation surgery. Did that one, and I'm here.
Wow, very, very day. Incredible. So,
Yes, yes.
so what sparked your interest? Why the specialty in exotics and avians? Where did you study? Where did it all start?
See, in India, we don't have a specific guidance or what you have to say certification to become an exotic or even veterinarian. We study from our experience first of all. Then I've taken diploma in wildlife from one of the oldest university called Tanuas, and there's one more diploma course, this PG diploma course ongoing, that is veterinary endoscopy. So I've done in my in birds. The wildlife work was done in turtles and tortoise. So only that gives us some basics of exotic or wild animals. But to become core into this, it's difficult. It's from practice only. As I said, I was a member of Aviculture Association of Kerala. Aviculture Association of Kerala, it is called.
Okay.
It's an association for bird keepers. So I got contact from there. So I used to visit their farms, get to learn about the basic husbandry practices, breeding practices, feeding practices, and identification is a basic thing to identify a bird, from which country it is, so how it should be kept, what is the size of the cage. Everything has to be dealt uh, in the deep way. Then only it will start to breed. Then from there only I got the base to start in exotic or avian medicine. I started with avian medicine first of all. Then I moved on with reptiles and small mammals. Here, small mammals, it's less actually. Means the cases that we get is very less. The mammal that I get is most commonly monkeys. That includes bombers and monkeys. Uh, this one, some wild macaque we will get. Then this tamarins, red-head tamarin, light-head tamarin, then white-lipped tamarins. Then we will get the spider monkeys. So not spider monkeys, squirrel monkeys. But rarely we get this rabbits, guinea pigs, and we do get good cases of hamsters, but not much as compared to other species.
And why the fascination? Where did your interest start? Was this something that you always knew you wanted to do, or was it something that developed and progressed?
See, as far as veterinary practice was concerned, I loved it. I wanted to become a veterinary professional when I was with a very young age because I got inspiration from a hospital just in front of my house. So we have got government setups from the grassroots level. We have got government setups like veterinary hospitals, veterinary dispensaries, and all. So it is a veterinary polyclinic. It's like a district hospital, veterinary hospital for the locality.
Okay, local community.
Local community. So they used to have a good number of cases, like 80 to 90 cases per day. That includes large animals, that is cattle, goat. Then comes the small animals like dogs and cats. Very few will come with birds and all. So I was very interested in veterinary practice. So when entered this undergrad, when I was in second year, I got interested into birds and all. Before that, I used to rear them. As I said, breeding purpose, I used to rear them. But my core interest started from second year onwards.
So obviously, if there were not people doing a lot of bird work, did you find that the cases would follow you because you suddenly took an interest in them? You would see the cases that were coming up. As soon as you express an interest within a practice, often the cases flow your way?
No, it was not like that because, as I told you, when I got my interest, I started to focus on books. The theory has to be strong, otherwise we can't do anything, right? So, as far as the theory was concerned, we had a good library in our hospital and our veterinary college. I used to follow that one. I used to keep that in a regular basis. Then one of my clients presented me one book, so I started using that one. And for this practical knowledge, that was the difficult part. During my house agency, I started to practice in a farm which had a good number of birds, like thousands of them, thousands of conures, and almost 50 pairs of macaws and 20 pairs of gray parrots. So it was the cradle for me to practice everything, to experiment everything. That was long back, like 8 years, 9 years before.
Wow. No, so I mean, dealing with birds is obviously something us as general practitioners, unless you have a particular interest, is quite daunting, particularly because a lot of the conditions, and correct me if I'm wrong, a lot of the conditions that you see are often husbandry related. How do some of the husbandry measures from your experience impact your patients, particularly if we're referring to birds here?
Almost 80 to 90% of cases that I get are gastrointestinal related. They realize it very, very lately. They may be based on a seed diet, not a seed mix itself, just a particular seed like sunflower seed. They are deficient in vitamin A and other minerals. So that is the gastric infections are the more common. So that comes from the husbandry practice. Whatever they give, whatever the honor or whatever the breeder gives, that is what makes the animal sick. But if we try to teach them, they're the boss. No, we have been keeping the birds for quite a long time, like 5 years, 10 years have been keeping. It hasn't showed anything. See, any deficiency will take time to show, but they are not ready to accept it. Except in case some are very, very passionate about it, they will accept. Otherwise, they won't.
So people struggle to actually put the two and two together because there is this time frame that they don't see sort of immediate consequence.
Yes. When you are concerned about this pet parents, they might see just one bird in their life or for quite a long time. It's not like dog. See, some birds may be with you for 30 years, 40 years and all. So they think that is the ideal protocol or prototype of a bird, and that is ideal protocol to be followed. Just give seeds or give whatever they eat. They may give rice, they may eat this roti and all. So they think that is the normal diet. Whatever it accepts, they think it is good for the bird. That doesn't mean it's good. Even if we give ganja or marijuana to a bird or a baby, it may consume, right? But that doesn't mean it's good.
Hey there, pet parents. It's Dr. Kara, the ultra pet vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why UltraPet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. UltraPet offers a 100% money-back guarantee. Try UltraPet's premium recipe for short-muzzled dogs today. So before we move on to some of the other husbandry measures, what would you be advising in terms of how do people, say first-time bird owners, if you've got someone, or if people are in a position where they have said, I'm feeding a seed diet, what is the advice that you're providing them?
First of all, I will ask them to research about it. At least they can Google it, right? What kind of bird it is. If it is a hookbill, like a parrot, or like a seed eater, like a passerines, like finches and all. So just at least Google it. Which kind of bird you're planning to get it. So if it is a seed eater, let them give seeds, no issues. If it needs some fruits, veggies and all, it has to be given. Then is the spacing. See, always we can recommend the minimum space. Even if we give the whole room for the bird, it may not be sufficient for it. So always stick on to the minimum practice or the minimum space requirement for the bird, so that it is able to fly. Once exercise is gone, that doesn't mean it can be obvious. It can be emaciated also. So proper exercise, proper movement, and the instinct to show its natural behavior should be there. So they has to consider the natural habitat also.
So do you encourage bird owners to train their birds to be able to leave their enclosures? Is this something, if you've got one bird, or say let's talk about a parrot, for example, is it a good idea to be able to have housing that they go into, that they're fed inside, but that they are able to get them out so that they can be exercised?
That's a good idea also, but it should be very tamed one. And what I get is that so much of fan hit injuries. If it is not acquainted with the surroundings, it is a very bad idea to keep the bird outside. So it's better to get acquainted with the things that they have, or else they should not have any fan, or else it should be guarded. Like the pedestal fans they have, they can use that one if they want fans and all. If it is a pet, definitely I suggest them to keep them outside sometimes, to play with them, to have some time, at least 30 minutes along with them, so that they will have a bonding with the bird and the fellow people. What I see is that the bird, a single particular bird, will be very much attached to a particular person. But some visitors come, they do attack them. I've seen it's very common here. I don't know why. Maybe they are not used to newcomers or something.
Absolutely. And so what are some of the risks for people to be aware of that are going to let the bird out? So say that it's a tame bird, they've taken the time to try and get it. And I would like to also take the opportunity after this to ask you about wing clipping. But before we go there, what are some of the risks? I mean, obviously escaping is one of them, but what are some of the things that they might like toxicity risks or danger risks that they may be exposed to if they are not kept within a confined space?
The emergencies that I've got was intoxication of metal, foreign bodies, and all. Then electrocution by chewing the wires and all. Then that happens in both caged birds and the birds that are let free due to the ring that they possess, the identification ring. I've got so many fractures. Maybe the most common fractures that I get is a deep tarsal fracture because of the ring got stuck in any of the spaces. Then accidental stamping on the bird if it is too small. Accidental barging. Some recent one I got, they were just playing, just snapped with a pen and it got fractured. So maybe it was annoying, but still, that was the recent fracture case I did. Then, of course, I get this foreign bodies, especially this paint and all. Lead toxicity, I usually get it when it is kept freely. It used to go in a particular corner where the owners doesn't notice and started to lick the paint on the wall.
And what about location? So let's say we've obviously established we now know what we're going to feed them. We've researched that. We're going to feed them to their particular requirements. We're going to make sure that their cage design is such that it's big enough. And if we can, we're going to tame them so that we can get them out and exercise. Where would we locate and where are the best places to locate the cage and to not? What are the places that you do not want to keep your parrot or your birds?
In India, we have got a specific compassion for birds to be kept in the kitchen because the Indian housewives or the Indian moms likes to talk to someone, especially to speak to the young ones. So the parrot or pet bird will be there in the kitchen, near to the kitchen. So whatever I have seen is that this smoke from the fumes from the cooking, especially we use so much of masalas, so that is irritating to the bird.
So that's a high-risk environment. And talk to me about Teflon, because that is something that I've had people ask me about. What is the risk with using particular pans and these birds, obviously in terms of fumes?
See, we get rarely Teflon fume cases. I got one or two, but that has recovered very well. They knew it was Teflon fumes. So they ventilated it. They opened all the rooms. So that cases we usually get in apartments, like in flats and all. So in India, we mostly focus on houses, villas and all. So if it is an apartment, it will be completely closed. So I got two of the cases, but it recovered. So I don't get such cases of Teflon fumes here.
So there's more awareness about it. And in terms of ventilation, is this something that you would encourage? Obviously, we talk about apartment living or enclosed environments. Is it important? Is it something that's a high risk that they can, if they're kept in a draft, is that a good thing? Is it a bad thing?
I don't actually suggest a direct draft. there should be circulation in the area where the bird is kept, because it can cause sometimes this respiratory distress, irritations, and all. Especially here, it is humid climate. They are suffering from aspergillosis mainly, maybe because of this high humid climates. Then, but definitely, I will suggest to give direct sunlight because they need direct sunlight for the production of vitamin D. Then only the calcium absorption will be normal. We're getting so many cases, especially in farms, where they think that they're getting sufficient sunlight, but they're not. Especially for gray parrots, we are getting crooked legs or bent legs or broken legs. So I've done almost, let's say, within 1 year, I've done 15 to 17 this leg surgery due to vitamin D or calcium deficiency.
So if we have owners who are saying, okay, from what I understand, you're wanting me to keep them outside. Obviously, kitchen's a bit of a risky space, and I understand with it being a communal area, it is so tempting because it's the place where lots of people are, and you can think from a mental stimulation perspective that might be valuable. What about birds being kept outside? What are the risks in terms of infection and obviously UV and some of the other risks with not being inside necessarily, but at least being kept on a balcony or in the garden or on the terrace outside?
The most common thing that I get is the predator attack, mostly the feral cats. If it is not in flats, if it is in villas and all, or normal houses, there are stray dogs that are continually attacking these birds and all. Then definitely transmission from this feral pigeons. This our Indian ringneck also has got some infections that are being carried, especially PPFT, which is very common in our normal wild Indian ringnecks. That has been transmitted to caged birds. So this infection is like what do you have to say? It's a dead end. It will die. We can't cure it, and it is slow progressing disease. Once infected, definitely the entire flock will be affected.
So let's talk. I'm a first-time parrot owner, and I've discussed the diet. I've got the cage. How frequently should I be cleaning this cage? In terms of husbandry measures, and what do I use?
Actually, if you are in an apartment, I suggest daily cleaning. If it is difficult, at least once in a week, it should be cleaned. Because once this poop or this leftover foods are kept, definitely mold or fungal growth will be there. So we are giving only a minimal space for the bird. So whatever comes, that if the mold sprouts, that is a new thing. Definitely try to lick it or to see what it is. So there is high chance that the bird will get a fungal infection or a bacterial infection once it is spoiled. If it is leftover food is there, it gets spoiled. So it's better you do it daily basis, or else at least in 7 days it should be cleaned.
Okay, that's great advice. And in terms of food and water, I mean, is this something the water's got to be replaced daily, or is it something that can be delayed?
I suggest daily cleaning because that is the best source that infection can prevail, especially the cutaneous one. They may be commensal sometimes, but once it enters the body, it can become a serious issue. So let it be a bowl. That is the best thing. So let it get a bath. It's fine. So you clean it, let it drink from it, so that we will know daily we are cleaning it. Daily we are giving it fresh water. If you're giving this nipple drinker or bottled one, definitely you can see there will be algal growth. There is some algae fungal called prototheca. I'm getting so much of prototheca infection here. So it's better you give it in a bowl so that let the bird will also take a bath. It's fine. Let it drink from it. So at least daily you're giving fresh water. Otherwise, you're keeping it for quite a long time so that the bacteria or fungus or the algae will outgrow and it will drink that water and slowly it will affect the digestive system.
And how do you advise the owners on cleaning these water bowls, the food dishes, the surfaces? Is there a chemical that's safe to use? Are there things that people currently use that is actually high risk for these birds?
I don't suggest chemicals. I tell them to clean it with plain water. Or else they can use apple cider vinegar at 15 ml per liter of water. They can mix it in water and use it. It's a very good antiseptic for birds. Safe antiseptic.
That's great advice. And in terms of, so we are imagining now that we've got a bird that's kept in the cage. There are obviously over time, and you've got to excuse me with my level of knowledge around birds in particular, I asked this out of total curiosity because we have become more and more aware of some of the things that we're seeing, like feather plucking and behavioral things that are associated with environmental things or lack of enrichment. Can you explain some of the things, the newer thinking around enrichment and how owners can achieve this?
That's what I told you. The owner should give some priority time for the birds also, a minimum of half an hour to 1 hour daily. Once that is gone, or the bird will be attached to some person or some let's say some toys or even the case. If you change that, it may start to show symptoms like feather plucking and all. Usually, I've seen in intelligent birds like gray parrots, macaws, cockatoos and all, they start to pluck it. Even smaller birds, which are very attached to the owners, will start to pluck to get the attention. It's a method of attention seeking. So once we pamper it, especially if cockatoos are like babies, they need pampering. So once they lose that pampering, they start to pluck it. Then it will become a routine. We can't usually cure it completely. We may be able to control it for 3 months or 4 months or 6 months. After that, it becomes again, it will back to this feather plucking. So if it is a pathological one, I think it's easy to handle. But if it is a psychological one, it's very difficult. So I've seen when the owner usually would keep them for boarding in some other place. If the owner is out of station for 1 week or something, if they have changed the cage, if they changed the toy, I've seen this feather plucking. And in case of this smokers, I've seen feather plucking. I think it's some psychological issue. Pathological things are commonly this in PBFT, citizen beak and feather disease. I've seen the quality of the feather also will change. Then in fungal infection, especially malassezia or Candida infection also, cutaneous Candida infections there. Then in case of tuberculosis, I've seen cutaneous lesions like yellow colored crusty lesions will be there. Then in case of herpes virus, but it mostly affects the bare area, like the leg area. Usually we'll see lesions. That includes the skin also. Then in case of polyoma virus, that is very common in budgies and all. So these are the feather issues that I commonly encounter.
So what I was asking in particular, obviously the time that owners spend with their parrots or their birds is really important. But if owners are facing time restraints or they want other ways to stimulate their birds to avoid some of the behavioral issues associated with cage birds, what are some of the things that you've come across that can assist them?
See, enrichment is definitely a good method, especially in the breeding setup. So what I've seen is that they will just give this neem leaves or guava leaves or guava bark or something to chew on, or so that they will spend some time on it. And in Kerala or in India, we'll get coconut with husk and all. So it's very, it's something that the birds can put some time on. Is that this, especially Macao, they'll keep on pulling off all the husk and all until they get the coconut. And some Macaos will break the coconut and drink some water also. I don't know how they're doing it, but they're very good at it. So, or else in a parent setup, what they can do is that if they're giving a grated veggies or fruits, they can give it as a whole. Don't keep it in the bowl. You keep it above the cage. So that it will spend some time breaking it down, biting it, so that it gets enriched. Something new has to be done, right? It is spending some time thinking that how should I get this food through this bath and also definitely that simple changes can make a huge difference.
That's great advice. I love that. And in terms of changing the cage design, is that something that could be potentially a stressor rather than a sort of a stimulating change for them?
So what I advise is that what they do is that they'll remove the old toys or something. They'll remove it first. First of all, what I advise is that you introduce something first, then you remove it, because the attention will change to the new product, and the old one is still there, so it doesn't feel that missing. So you introduce something first, then you remove the old one. That is the best thing I've been practicing for small birds and all. Once that is missed, they'll always say, "Oh, there is something missing. There is a huge change in the setup. So something is wrong." So it's better you introduce a new toy, then you remove the old one. That is how it should be done. Don't suddenly change it, especially for a pet bird. Don't suddenly change the setup of its cage. And while changing the next box also, it's better to change it in a very slow manner, because some birds will prefer lying in the bed, or in a particular cloth will be there for them to lay. So changing that is a difficult task. Or else use the same color or same texture, then uh, though they are colorblind, but the changes will be there. So it's easy. So same texture cloth will be there. We can change it accordingly.
And when I've seen parrots sometimes and I'm talking parrots just generally as an example, but I've seen them in an enclosure and there's a bell or something put in, you sometimes see a behavior that you don't know whether this is a happy bird or one that is really frustrated and irritated, when they are displaying signs where they're ringing the bell and there's, squawking and screaming. How do we interpret that? Is that a positive thing or is that a stress response?
If I get a stress response, because whatever we have got our what do you say, notion that whatever the bird does is cute and it is happy. I don't know. Sometimes it may be stressed. That's why it's showing the symptoms. So we humans assume that it is very happy and it is playing. It may be stressed like anything, and it is maybe yelling at you. So that has to be considered. So most of the time I get a stressed bird ringing, belling, moving its head, bobbing its head. It's a stereotypic behavior actually. It is very common in monkeys and all, especially kept in the confined state. It will show stereotypic behavior like head bobbing, rolling and all.
How interesting.
In parrots, it is not that much established. The study is not that much. That's why, but what I feel, it is stressed.
No, I can see why. And in terms of the external stimulation, we spoke about kitchens and about it being a nice, busy environment. If you're going out, is it something that you could say, leave the TV on, put the radio on? Are those ways that you can provide company through sort of a vocal reassurance, or is it better to avoid those kind of stimulations?
You can go for some audiovisual aids to make the animal company. That is a good idea, actually. Otherwise, if you keep them idle, they will start to peck or bite to other things and start to make noises. So it's better to train them with some audiovisual aid. But the thing is that if it is not from a breeder setup, it has been kept only in a petted environment, it may not enjoy that much. Once it has got some signs of wild instincts, like if you keep the voice of a similar parrot, it may respond. But if it is not used to it, it's a less chance that it will enjoy.
So let's talk about the day-night thing. There are a lot of owners who ask us about whether they should be covering their birds at night, not only for their own sanity because it makes them go quiet, but is this something that's advisable, and if so, why?
That is a better choice. You just cover it so that it becomes dark. They need some darkness. What do you say? A quiet place for them to sleep, to get rest, so that they feel safe. So it is their natural instinct. Once we give let's say in breeding setup, I will start with that. In a breeding setup, if we give a big room for them to breed or to lay egg, they won't lay egg because they feel like, oh my God, it's so big. The entrance is so big, so some predators can come in. It won't breed. So it's always better to give a nest box, which is very small, so that the bird will squeeze in and lay the egg. So they feel that mistake. Only I can move inside, or nothing big can come inside. So they feel like that. Just like that, if you are covering the bird, it is a good idea. Some birds require fan, not because of the draft. It's because of the sound. They want fan to be strong. I've heard in like 4 or 5 pet parents are there. Similar thing that they don't need this draft or the wind to be blown. They want the sound to be heard for the birds. If the sound is not there, they'll start making noises.
So before I lose the opportunity, I want to ask you about wing clipping and nails, because obviously, a bit like our cats and dogs, it's sometimes a common thing that people will visit for preventative sort of healthcare measures rather than when their pet is sick. One of the things that we've seen just as general practitioners is owners who have put sandpaper over the perches, ways to try and reduce the nail length that have actually done more harm than good. Is this something that you've seen? Is this something that owners are now more aware of that you're not seeing so much? And how do owners manage that nail length?
Here also, they advise us to trim it to the maximum, but the quick, that's what we can say. Let's just like the dog, there was some extended portion of blood supply. So it is very near to the tip of it. So even if you try to clip it, definitely it will start to bleed. So grinding can be a method. Or else you can go sandpaper purchase, but that does not give that much of good result, I guess. The same thing, they may come with a different opinion, like we'll have to trim once in a while, then only it continues in that particular shape and all. Uh, the owner feels so irritated when like one small abrasion is there, when it just that feels scratchy. That's why they want the nail to be trimmed. After all, it's the owner's choice. No, even if we dishearten them, then still it will make a bad review. Actually, it's all about bringing the client back, right? So we don't want the client to be feeling bad. Even if you advise too much, they feel like being offended.
Yes.
So we'll just go with their idea.
And in terms of wing clipping, is there something that you advise? Are there any risks?
Wing clipping, I always advise them after the complete feathers come. Usually, parrots, the complete feathers come in 3 months. I make sure that it doesn't have any blood feathers. If there is blood feather, if we cut it annoyingly, sometimes we'll have to remove from the base itself. Otherwise, it will keep on bleeding, and some birds may even die. I've got a case where the owner tried to clip it. It started to bleed from the feather tip and it died. Maybe because of stress, but I feel it was due to blood loss. But if there's expecting some escape and all, I think it's better to clip it, but not in a complete manner. Like you can clip it below the coverts. There is one layer of feathers called coverts. You clip it below the coverts and keep some feathers so that it will fly and land safely. Don't what you have to say. Don't make the bird a handicapped one so that it will fly and crash land, causing the sternal injuries and all. So what I do is clip at the central portion, or you alternately you can clip the wings. That can also be done so that some flight will be there. If a cat comes to bite it, it can escape. The sole purpose is not to fly like the normal one, reduce the mobility. That's all.
Totally agree. Totally agree. You want to prevent escape risks without causing more risk to traumatic type injuries. I totally agree. Now let's talk about some of the cases that you've seen that have required, and I'm smiling here because I'm so excited to hear advice, but have required owners to provide medication. So unlike I'm going to say maybe similar to cats. There are some cats that you just do not want to be asked to give medication to. I think in the same way, I would not want to necessarily be asked as an owner to have to medicate my parrot. What are some of the ways and tips and tricks that you can give me that may help the listeners who have parrots if they're given medication to administer this, if let's say if it's orally?
I will suggest that to birds which are being hand fed from the baby itself, or they have a, a routine plan of giving hand feed to the bird. It is easy or comparatively easy. But once the taste of the food changes, it may reject the food. But still, it is good idea that give them medication in the food. Otherwise, the thing is that if we give the medication as such, if we force it, it can directly go to the trachea. I've seen so many cases of pet parents killing the bird, try to give the medication, especially liquid medications. So that will make the owner also like desperate because I've killed my own bird with my hands. So they feel like that. So in any way possible, I tell them to give it in food. Some medicines cannot be mixed with food, but what I feel is that something is better than nothing. Without giving in medication, it's better to mix it with the food or any juices, especially if you are going for antifungals and all. You can either mix it with the fruit juices or else high fatty diets you can go for. In peanut butter and all, you can mix this products and you can give it. So honey is something that the birds may accept, but be careful with the quality of the honey. You can mix it because especially all these products, if it is human or pediatric ones, we may use, we may off-label, we may sell it for birds. We don't have such specialized bird formulas, means medications. So we may substitute with pediatric ones. These are usually sweet. So birds, especially parrots, will accept it. But some may not accept it. That medication we will tell them to give it in the hand feeding formulas. So one thing is that you can use fruit juices. Next is the honey. And the first thing actually is the hand feeding formula. You can mix the hand feed formula and give medications so that something will go inside.
That's great advice. Very, very helpful tip there, because we've also been often asked, can we put this in the water? And of course, from a dilution perspective, that is not not so practical. Plus, we do want them to continue to drink. Before I lose the chance, because I know we are running out of time, and I do want to get some of your advice on what are the kind of signs that owners can recognize that may indicate that their bird is not well. So what are the main things that you look for, obviously, as a vet, that you can pass on to our owners that may say there's something wrong and you need to get this bird to your vet?
So the tricky thing about exotic practice is that the exotic birds or exotic pets won't show much of the symptoms. It may be eating, the next moment it's a dead bird. You may experience it sometimes if you're practicing. Definitely, if you ask any exotic veterinarian, any avian veterinarian, this may be the first thing. A live bird may be dead on the next moment. I've seen, especially lower kids, that they will play like anything, eat like anything. They'll just move to the perch, fall down and die. I've got so many cases, especially in farm setup. I've completed my farm visit and all. And I told the coconuts just fell on the roof. While hearing the sound of that, one bird collapsed due to heart attack. So these are so fragile, but still we can get so many things from an infected or a sick bird. First thing is their behavior. If it is an active bird, activity will get less. If the feathers will get puffed up, it will get fluffed up. Then usually the brightness of the feathers will get dull, and it will start some staining will be there in the that I've already noticed. Some marking will be there in this side, maybe due to salivation or maybe due to vomit and all. The overall quality of the feathers will get reduced. Next is the body weight. We'll have to check the body weight. We should know the body weight of the pet. Definitely, they should have an idea about the body weight. the practitioner should know the normal body weight of a Macao, blue and gold Macao, green wing Macao, or whatever cockatoo. They should have an idea how much weight it should be, so that once they weigh it or over a phone, if you call and tell that, oh, my Macao is just 700 grams. It's underweight. It should be at least, a blue and gold should be at least 900 to 1 kg. So definitely we know the body weight is less. And you ask them how the chest is. That is a good indication where the keel bone will be very prominent. Usually the pectoral muscle will cover the keel bone. Slowly, once it starts to lose weight, it will start to deteriorate and you will feel the bone very, very much. Then, if it is a pampered parrot in a diseased state, usually it will beg like this. It will keep on nodding the head like this. So that can be a sign of disease. Then check the poop. If it is diarrheic, it will be a mix. You can't identify the fecal material as a sausage shape. We can identify the urate, it's white color. You may not be able to distinguish the urine. Usually we can distinguish this everything, these three things. But usually in a diarrheic form, it will be in a mix.
So recognize normal, understand what's normal for your bird. And then if anything from behavioral to nutritional eating, it flags up, it's worth getting advice early on. Because from what you're saying
Definitely.
is they hide their signs.
Not like dogs and cats. They may show severe symptoms. Any slight changes, definitely, I think it's better to visit an avian vet or an exotic veterinarian or any veterinarian. Definitely, a vet is much better than anyone else, right? So that's what I tell. If they may over the phone, they may call me and ask, "What should I do, doctor? My bird is sick." I will tell them, "Get to a vet." Oh, he doesn't treat birds, just dogs and cats. It's fine. Let it be dog, cat. We have been trained to treat all the animals, right? So they can do at least something, maybe better than them. Definitely, that's what I do.
No, that's really good advice. I agree. We all have, the skill set, even if it means, asking a colleague or opening a book and taking an interest, because some of the basic principles can be applied across all species.
All species, yes.
My final parting question before I lose the opportunity. I have a client and they've said, my child wants a pet bird. What is the general advice that we should be giving as veterinarians and as professionals who understand things about the complexities of keeping them, how long they live, the risks associated with them? What is some of the advice that you give, say, parents whose children want to start and have an interest in birds? Where would you be starting?
The baby, if you're planning for your child to be having a pet, it's best to give a dog a cat. Exotic pets, it's not a good idea until he is able to recognize, he is able to do everything by his own, or he has got the senses to know that it is a bird, it is a living being. Otherwise, if a small bird, if you give it to a small child, it will start to squish it, right? So that will kill the bird. But that can be done to a dog or cat. It's maybe fine. But so I always suggest to pet these birds when they are about at least 10 years of age. Then they will have some senses to how to care it. It's a bird. It should be handled very softly to know the basic things. They will start to know it. Or else the parent should be very, very, very careful to give them in hand, or how they are being adjusted, how they share the bonding and all. So it is very difficult. See, this thing of a snake being petted by a small baby, it's not a good idea. It's what I feel. In most of the cases, especially what you're getting is, of course, they may be very, very timid, docile and all, but there are instances that they can attack. Yesterday also, after treating the animal, it's very small, just 50 centimeters of baby anaconda. I gave the medication. After that, just looking at me, it paused a second and bit me. But it's a small one, but it didn't cause much problem. But I think that happens to a small baby if it bites. It will have that memory for quite a long time. Let me think that all these animals are dangerous. So it's not a good idea to give to a very young age, but if they are sensible, if they are having that consciousness to keep this birds and all as pets, it's a good idea. So I think age should be there to keep this exotic pets as their pet. Then one more thing is about handling risk and all. I have seen so many zoonotic diseases, especially starting with chlamydiosis, allergies, tuberculosis, and Japanese sensibilities. Avian influenza, it's common in India now, but it does not spread to human beings, but there is potential risk that we are taking, especially as veterinarians. There is high risk. Sometimes I feel like once I have got some deadly disease, when I get some common cold or flu, I feel like, oh, it might be chlamydia, it might be this avian influenza. We can't sleep, right? We have got a family. We are giving that to our family, our relatives, and all. We feel so much troubled to keep that in mind.
Yes.
So I don't know if it is regulated in other states, other countries, but in India it's very loose. The regulations strictness is very loose. We're getting commonly the salmonella cases in reptiles and all, and people are getting, I guess, but no one is bothered. It is not being legalized. That is the issue.
So you say stick, ideally, unless you're prepared to take on the responsibility, and obviously that there's handling awareness to a dog or a cat when they're particularly young, even though those are also risks sometimes. But this has been so informative, and I know that we could go on and on. There's so many things that I know you could share with us, and hopefully we'll get the opportunity at some point again to talk about some specific cases, some exciting things that you're doing. I know people can follow you on social media. You're sharing some incredible footage about some of the surgical procedures that you're doing, some of the equipment that you utilize, which is just, from a veterinarian's perspective, so amazing. Even the size of the ET tubes, for example, that you were showing on your social media account. So thank you for the work that you do. Thank you for your time today. And hopefully we'll get a chance to explore some more topics around exotic pets and avian medicine. It's just been really, hopefully, very informative for my listeners. It's certainly been very interesting for me. So thank you, Dr. Abraham.
Yeah,
I really appreciate it. Yeah, so appreciative. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Kara.
Hi, Doc. It's Justin the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.